we are back with Dr. Johnson of Grandover Village Dental Care. He's answering all of your dental hygiene questions. All you have to do is text your questions to 336-379-5775. All right, going back to it, we have another viewer who says, I know sugar's bad for my teeth. How do I avoid eating sugar when it's in everything?
It's a good question. It is in pretty much everything. Well, I'm not a nutritionist, but definitely maybe one of the best ways would be kind of cook your own foods so you can control what goes in it. If the recipe calls for 3 cups of sugar, you can, modify that and cancel that out. I guess if you're drinking coffees and things like that, you can substitute the sugar for some different type of sweetener. Um, they have artificial sweeteners, which aren't sugar, but derivatives of sugar. It's hard, especially in America. There's sugar everywhere, and we know that when we try to eat healthier, the price goes up a little bit. But you definitely want to try, right? Wherever you can, substitute that sugary thing for something not sugary. Um, Drink plenty of water and definitely exercise. Like being healthy overall, it's gonna help. It's all related. What you put in your body, how you live. So when you can, cut back on the sugar.
Nice. Okay, so next question. Do I need a veneer if a tooth is cracked?
Come see us and let's see how bad it's cracked and what tooth it is. When we think veneers, we definitely think kind of in the front. So if it's a front tooth that's cracked and there's space for a veneer and that's something you want, we can work that out. If it's cracked to the point where a veneer won't mask it enough, it may need a crown that goes all the way around the tooth. Veneer kind of just sits on the front of it. So come see us and let's talk options. If it's bothering you, if it's painful, that's going to be kind of a different process than if it's just a cosmetic little chip. So let's evaluate it and we'll make sure you got the best treatment.
The next question we have, what can you do if your tongue stays sore for a long time?
If your tongue stays sore for a long time, well, I think the first thing to do would be finding out what's causing your tongue to be sore. We can find that out and eliminate that. That would help. Um, yeah, we got to find the root cause of that.
I think that's great advice too. You got to figure out what's going on. All right, the next one. What is the best toothpaste?
My favorite, I really like Crest. This toothpaste called Gum Detoxify is one of my favorites. Um, and the other one I mentioned earlier, the Crest 3D Brilliance, that's my lady's favorite. So definitely two to look out for.
The next viewer says, I have a 3-year-old granddaughter who chipped her front tooth. Should we be concerned even if it's a baby tooth?
It depends on how bad it's chipped again. If it's just kind of you see the chip and it's still kind of the white part of the tooth, the enamel, I'm not as concerned with that. If it's chipped and you can see different colors where you see maybe the pulp or the dentin kind of underneath the tooth, then that's something we do need to check out and make sure we correct. Because even though they're baby teeth and they will kind of lose them, and that's all good, you get to start over. When baby teeth get too, I guess, injured, I guess would be the word, and if a baby tooth gets infected, it can create issues for the tooth coming in behind it. That infection can kind of matriculate into the adult tooth that's trying to come in. So if you have a baby tooth that's chipped or fractured, and you notice your baby's disposition is off, like it may hurt, or if you notice some swelling, definitely come let us check that out.
And then the next one, when is it a good age for children to have milk teeth removed?
Children to have their baby teeth removed. So children lose teeth for a long time, from about age 6 to, around age 13, 12, 14, you have a continuation of losing teeth and growing your permanent teeth. So it's tough to say. Most parents probably won't recognize that a baby tooth has been in too long. But if it's loose, if it's wiggly and it's not going anywhere, come let us see it. Because a lot of times that permanent tooth is trying to get in behind it, but it can't for whatever that reason is. And if that goes on too long, you'll get teeth, kind of overlapping each other or just growing in different directions that you don't want. So you notice your child is starting to lose teeth. If they don't already have a dental home, already hasn't seen a dentist, you definitely want to bring them in. I encourage all children around their first or second birthdays to have seen a dentist already.
I think this is great advice. We appreciate you for being here too today, Dr. Johnson, and kind of helping us through the teeth. They're tough. They're tough out there. So thank you.